On our Health Beat this morning, we welcome a special guest. Joining us is the Senior Vice President and Chief Medical Officer, Blue Cross Blue Shield of Michigan, Dr. James Grant, back with us on WKZO. Dr. Grant, how are you this morning?
Good. How are you, Ken?
Very well. Thanks so much for joining us. Our topic this morning is how patients can advocate for themselves when they go to the doctor's office. So I guess the first question I have is, why don't we?
Because it's easy to put off.
It is. It is easier just to let it go. So what situations really lend themselves to standing up for yourself?
Well, Ken, you are your best advocate. Preventive care actually aims to prevent health problems from occurring or actually even getting worse. And checkups, screenings, tests, discussions with your physician, they all assess your health status, and they all will give you a roadmap of where you need to go. So that's why I can't emphasize enough how important preventive health care is. Actually, most, screenings, vaccines, exams, preventive exams are covered by most health plans. So self-advocacy, who can advocate for themselves better than themselves? It's so important. You got to be your number one spokesperson.
So, Dr. Grant, how do we do that if we've been reluctant all these years to not stand up for ourselves in the physician's office? How do we change that?
Well, first of all, the first way you got to change it, you got to make sure you got your own primary care doc. You'd be surprised the number of people that don't, and when they get sick, they start either beginning to find a doc, or they show up in an urgent care, or they show up in an emergency department. It's really important that you get your primary care doc to sort of quarterback your health, to make sure we're getting your vaccines on time, to getting your routine blood work on time, to making sure you've got, your screening colonoscopy scheduled appropriately. That's the first step you got to take. Get yourself the doctor that's going to actually work with you to coordinate care, that someone you can go to and someone you can ask questions to with.
Dr. James Grant from Blue Cross Blue Shield of Michigan with us on our Health Beat segment on WKZO this morning. Are there certain rights that a patient has in terms of their health when they go into the doctor's office, things that they might not know because they're not really thinking about it?
Yeah, one of the things they've got to, talk about certain, essential things that you need to ask. Ask questions. Prepare for your visit. Make note of any changes, not only in you, but, in any, blood-related family members. Make sure your doctor knows about any new medications maybe a different doctor has given you. Don't forget the over-the-counter, the vitamins, the medications, the herbals. These drugs are, you buy them over the counter and they think it's an herbal. They do have effects on other things. So ask questions. There's no such thing as a dumb question. The only dumb question is the question you don't ask. Ask questions, get an explanation, get a blueprint to move forward so that you and your doctor are really on the same page and really looking out for your health.
So as far as insurance goes, what should a patient do to prepare from the standpoint of their insurance before they head into a physician's office?
Well, your insurance actually, to tell you the truth, Ken, your insurance is going to encourage you to make sure you've got great preventive care. Your insurance is actually going to, you as long as you have a solid health plan, you make an appointment, and preventive care is so often covered. We want people to stay well. That's our goal. Our goal, is to make sure that our members actually stay well, get the care they need, get updates, and move forward. That's our goal, and I think this should be most health plans' goal. We want you to be well. It's actually much easier to keep someone well than it is to treat disease.
So this should be more of a partnership between a patient and a physician rather than an adversarial relationship?
Oh yeah. You've heard this. It's a total partnership. That your primary care doc is your health care partner. They are your angel looking over. What are you doing? How are you feeling? Are you up to date on your test? Has your blood pressure gotten out of control? Is your numbers that indicate diabetes, like a number we call a test we call hemoglobin A1C, is that rising? It's easier to see that a number's going slowly up and we can address it than to see it skyrocketed up. These are all things we do it with our cars. You get your oil changed every X number of miles. You know what? We got to do the same with our bodies.
So, Dr. Grant, for those who want to explore this topic a little further and maybe get a little confidence about going into a physician's office, where can they find more information about what we've talked about this morning?
You can find more information on MI, as in Michigan, MI Blues Perspectives, mibluesperspectives.com.
Our guest, Dr. James Grant, Senior Vice President and Chief Medical Officer, Blue Cross Blue Shield of Michigan. Always a pleasure to chat with you. Thanks so much for the information this morning.
Stay warm and stay safe, Ken.